Hello and welcome to this episode of Hampton Roads Business Live. My name is Rory Graham and I'm your host. And today we have with us James Maggio from Pro Adjuster Chiropractic Clinic, and that's Dr. Maggio.
That's correct. Thank you.
Well, welcome. And why don't you give us an overview of what is the Pro Adjuster Chiropractic Clinic?
Very good. Well, thank you for having me visit with you today. I appreciate it. The Pro Adjuster Chiropractic Clinic, I started in practice in 1995. It's over on Independence Boulevard in Virginia Beach, right by Mount Trashmore, where Holland and Independence meet. And basically, with the exception of a couple ways that we take care of people, it's very similar to most chiropractic offices. We see most of our patients have headaches, neck pain, low back problems, disc issues, arthritis, things of that nature.
Okay. All right. So let's talk about but I want to get into the Pro Adjuster thing in a minute, but let's start off with what is the difference between your clinic and, let's say, a traditional chiropractic clinic? Is it the Pro Adjuster
yeah,
that is the difference.
That's the main. That's
all right,
the main
I just want to make sure there wasn't anything else. So let's talk about that, because I found that very interesting when we talked on the phone.
Thank you. Well, you know, the first 5 years I was in practice, this system didn't exist. So I did everything the way most chiropractors still do. And for the people watching this who've never been to a chiropractor, what chiropractors do is we feel people's spines with our hands, called palpation, and we're trained for years on that. We go to school for 8 years just like MDs do, but part of our training is to really get our hands very sensitive. And what we're actually feeling, I'll show you on this little model, is the back part of the spine comes together on these little hinges, and they're supposed to rock back and forth. And what chiropractors do is we feel this by hand, and the whole premises of what we do is if the joint is stuck and jammed together, then it squeezes these. These are the sensitive nerves, and then wherever these nerves travel can cause pain. Well, in 1999, the instrument, the Pro Adjuster, was FDA approved, and it's a computerized system that's it's a handheld device that's actually attached to the computer, and what we do is we take it and it literally taps into each vertebrae to see if the vertebrae is moving properly. And what we find is, for example, let's say someone's coming in with headaches. Well, there's 2 or 3 nerves that come out of the back of the head that when they're irritated, travel up, can cause headaches. So what we do with the instrument is we take it and it gently taps into the joints, and if we find that that nerve is getting irritated because the joint's not moving in the upper part of the neck, then we found the cause of the person's headache.
Now, you were telling me when we talked that it's a great diagnostic tool because it can detect whether they're a candidate for chiropractic help or they have to go to an orthopedic surgeon or something like that. And so that's something that could be useful to diagnose something that, in other words, you don't want to waste a whole bunch of trips to a chiropractor when they can't help you.
You're absolutely right. And that's the one thing that can get very confusing. If there's lots of little muscle spasms right over a joint, it's very confusing sometimes for the chiropractor to feel, well, am I feeling a hard muscle that's just knotted up, or am I feeling a locked joint? And this instrument's able to pinpoint that. So if we scan someone with this tool and we find that it's all muscle problems, well, they're better off going to physical therapy. They're better off maybe getting a massage. Maybe we could show them some stretches to do. And if it's like a really bad muscle spasm, we might send them to a physiatrist, which most people know as a pain management facility, to get an injection to start breaking the muscle spasms up. If it's a true joint problem, then chiropractors are the best ones for that. So It does make a big difference.
All right, now, if I recall correctly, there's some treatment value with this procedure as well, right?
Absolutely.
Can you tell us about that?
Right. Well, to tell you the truth, when I first purchased the instrument way back when, the only thing I was going to use it for was just to analyze people. I wanted to have that extra advantage to make sure we were accepting the right cases. You know, I didn't want to tell people, we're probably going to help you, it looks like we're going to help you. You know, no one wants to hear any of that wishy-washy stuff from their doctors. So my intention was just to treat people the old way, the turning, popping, cracking, and twisting, because to tell you the truth, most of the time we got a pretty good result with that. But after I had it for a little bit, I started introducing it to some of the patients, and what we found is most patients who were under any form of chiropractic care, when we introduced the Pro Adjuster treatment with them, actually enjoyed it better. And it's not everybody who gets better results with it, because that would be unrealistic. But what we find across the country of the 1,000 offices in the United States using this technique is about 93% of all patients who have experienced any form of chiropractic before feel they get a better result with this instrument. So every now and then I'll have a patient who responds better the other way, and that's fine. But for the most part, patients just enjoy this because two reasons why. One is when we treat people with this, that instrument goes right on that joint that's stuck and it taps at a very, very high speed, up to 90 times a second. And that's quicker than the body can feel. So it doesn't hurt when we do the procedure. And the sensor in it is so sensitive that it will actually read when that vertebrae is moving better and the pressure's off the nerve to relieve their discomfort. So patients like that because it doesn't hurt. And the other thing that they like is after I treat them, we actually instantly reanalyze them to see how much changed, and we can tell if it was a good treatment, an average treatment, or a great one, or even sometimes poor. For some reason it just didn't go well. So we can give them a realistic expectation on how quick it's going to take to get them better.
Okay, and there's no cracking.
No cracking, right. Now, I'll be honest with you, some people really like that. They really do.
Some people like the cracking?
Yeah, some people do. And that's why we have chiropractors who do it the other way. But what we tend to attract in our office because of this instrument is people who've never been to a chiropractor before because they were afraid of the cracking. We also see a lot of people who have tried the other system with the popping and cracking, but they just couldn't relax. They couldn't get to the point where they can have their neck loose enough where the doctor
You do that too, though.
We do that.
Yeah. So, either way, you can handle them.
Absolutely.
Okay.
Yep.
Play on words there. Thought about that after I said it. All right. So what type of, I know you mentioned a couple of things, what type of conditions do you typically see people for? Is there some that are more frequent than others? Is it low back pain or regular back pain or neck or
Yeah. Tell you the truth, the majority of the patients we see, probably about 80% of them are either going to be low back problems or headaches. Those are the main ones that we see.
And the headaches coming from their back?
It's coming from their neck usually.
Their neck, okay.
Right. So when a person has an irritated nerve in their neck that goes into the head, they usually don't get neck pain. They'll get the headache pain instead. Just like some people, when they have it in their lower back, it will go down their leg and they'll get the sciatica pain. So there's a ton of different symptoms that we'll see from a pinched nerve in the back. Hip pain, low back pain, even knee pain, or sciatica. If it's in the neck area, it could be neck pain, headaches, things of that nature. Sometimes it gets so bad in the lower neck that it can go down the arm and cause numbness or tingling even in the hands because it can get so irritated.
So, like for headaches and all, do you find that a lot of that is do you help them address the causes of that? If you fix it or loosen it, but it's caused by how they're sitting or, maybe they're at the computer all day or where their keyboard is. All those issues, I know from doing safety videos, all those issues can impact your back and everything, your positioning all day long. Ergonomics, I think they call it.
Absolutely.
So do you talk to them about that and
sure.
kind of educate them a little?
If we didn't, treatment would pretty much be useless because it would be a temporary thing.
That was the answer I was hoping you were going to give me.
It wouldn't be the right thing. So basically what we have to do is get the person out of what we call crisis mode where they're feeling better. That's why people come in, is because something's hurting them to the point where they can't do the things they either want to do or need to do. It's one of the two. It could be someone who says, hey, I can't sit through church every Sunday anymore because my back's hurting me so more, or I can't concentrate in the afternoon to help my kids with their homework because my head's pounding, things like that. So you're absolutely right. We have to address their main problem, which is that joint that's stuck, but then show them things that they have to change in their life to get a long-lasting result. Otherwise, they keep spinning their tires and it never really gets fixed.
Right. Now, how about disc problems? Is disc problems something you can help with? Because I've been involved in a lot of video depositions because we shoot video, and I hear about ruptured discs, and mostly it's orthopedic surgeons we're doing. So I know there's surgery that can help that or work on that, and my wife had back surgery. But what can you do for disc problems?
Well, there's a couple different types of disc problems. Let's start with the worst, which is the rupture. Usually if someone's disc actually ruptures, it's kind of like a balloon that broke. If that happens, then you're almost always off to the neurosurgeon. That's just it. That's it. Usually by that point, it's too far along for a chiropractor or physical therapy to do much with. If it's a herniated disc, then we're usually still able to treat that.
Is that like a bulging disc?
A bulging disc, yes. Bulging disc or herniated disc is pretty much the same thing. And that's where part of the disc fluid gets pushed back into the nerve root because the joints are locked up. So if the joints are locked up and stuck and that nerve is getting irritated on the bulge, we're able to mobilize the joint, which takes the pressure off of the disc. Some of the disc can actually recede away from the nerve, and then the person feels better, and a lot of times they don't need surgery. Over the course of my career, we've had so many people who were said eventually they're gonna have to get surgery, maybe 2 or 3 years, and we've helped them prolong that, 10, 15, 20 years from that diagnosis. Sometimes they're still gonna have to get it, but most people wanna put that off as long as possible.
All right. Now, how about the term you hear a lot, scoliosis? Doesn't everybody have scoliosis of some sort? I mean,
no, they don't.
No?
No.
Okay.
It's actually only about 1.5% of the population has scoliosis.
Oh. Okay.
Yeah, so pretty much 1 out of 100. The thing that's interesting, you brought that up, in my practice, it's about 35% of our patients. The reason why it's so much higher is when someone has a curve in their spine, they're not balanced. Okay, so some muscles are working harder to hold you upright, to just keep you balanced. And when that happens, it's easier for a person to actually get injured, whether they fall and their injury is worse because they had a weakness already, or just sitting at a desk, those things happen. So I do see a lot of people have scoliosis, and to tell you the truth, it's been much more frequent than it was early on in my career. And
why is that?
I think it's simply because everyone has computers now.
Sitting.
Yeah,
Okay.
I mean,
and
that's it.
that probably kind of leads to the next thing I was going to ask you about is carpal tunnel. Same deal?
Carpal tunnel is a little bit interesting because carpal tunnel is one of those diagnoses that usually is incorrect, not just from a physician, but mostly from the patient's point of view. If someone has a bone in their wrist that's pinching the nerve right here, then it actually is true carpal tunnel syndrome. And if that's happened for a long, long period of time, scar tissue will actually wrap around the nerve and it will cause the fingers to go numb. If it's coming right from there and it's an injury in the wrist from overuse, then surgery is the best thing for that, okay? If that's the case. Most people don't have that though. Most people have an issue where there's a nerve pinched in the upper part of their back that radiates all the way down into the arm, and they get the same symptoms of the carpal tunnel. So if someone has that and they accidentally get that carpal tunnel surgery, but it's from up here, then it doesn't do anything. That's why the Pro Adjuster is such a valuable tool, because if someone's coming and says, my doc said I might need to get this carpal tunnel surgery, what do you need? What should I do? Well, if I find that there's a joint problem in the lower neck, they don't need the surgery. But if it's not there and it's all from here, then they might need it. So. If that answers the question, it's kind of a little tricky one. The diagnosis on that one.
So the Pro Adjuster would help.
Oh, tremendously,
diagnosis.
Absolutely.
Be
And
more accurate.
some people are unfortunate; they got it here and here. So they might need a couple different doctors taking care of them. But usually, it's from the neck.
All right, and arthritis. Now, I know that's something everybody of age can.
That one you're right about. Everyone gets arthritis. There's just no way around it. Arthritis is there's 2 types. There's the rheumatoid and then there's the osteoarthritis. Let's stick to the osteoarthritis. It's the easier one to talk about. Osteoarthritis is the wear and tear disease. I call it the body's form of rust. Okay? So if someone has a job, let's make it real simple, like they're a bricklayer, and they're bent over for years and years and years, they're going to create trauma and injuries to their lower back, and they're probably going to have arthritis in their lower back faster than other parts of their body. Well, the main reason why arthritis occurs is when those vertebrae get stuck and locked and they don't allow fluid to get pumped into the disc. See, every time your vertebrae move, fluid gets into the disc to keep them thick. And as long as they're thick, then the arthritis process doesn't occur. But if they get stuck over 10, 15, 20 years, then they'll start thinning out, and then bone spurs grow, and that's what true arthritis is. So the conversation that I usually have with patients is if they say, well, you know, you got some arthritis there. Well, everyone has arthritis. Well, let's look at that person's spine. Well, if everyone was going to get arthritis, wouldn't your whole spine wear out the same rate? And it doesn't happen that way. It's the areas that are actually injured themselves.
So, but I mean, most people have a degenerate disease going on. I mean, it is going on. I mean, as you
Absolutely.
age, you have a certain amount of, like you said, rust going on. And okay, all right. So everybody has that. So as you get older, you're more prone to some of these things that have been building up for years.
Right.
Okay. Another thing that you had mentioned to me was the no wait time in your clinic.
Yeah, we're excited about that.
I wanted to see if you were going to stick with that story.
It really is. I have to tell you, it was really fun. It's funny that you said that because Thursday, a couple of days back, we had a patient came in, and she, I don't remember what time, let's say she's supposed to be seen at 3:30. She was a brand new patient. Well, she got there about 10 after 3. So she got about 20 minutes early, and one of the staff said, oh, you know, we want to thank you for coming in early. And she said, oh no, this was my appointment time. So we thought we actually made a mistake on her appointment, and I personally stopped what I was doing, went out and apologized and said, listen, I'm really sorry if we made a mistake, but we're not going to be able to see you for about 20 minutes. And she said, okay, it's no big deal, I'll stay. So she stayed, and I did her whole workup. Well, after she left about an hour later, she gave us a call and said, you were right. The time was actually 3:30. I read the email incorrectly. So people in today's world are just nonstop running everywhere.
So did you bill her another $25?
No, I did not.
No,
No, we don't do that.
I'm teasing with you.
No, but it is interesting though, is because we keep track of it. I like managing the office on statistics on what we're doing right and what we could actually do better. And one of the statistics that we keep track of every week is how many visits do we see on time or early. And it's about 98%. And we're about 3 times as busy as the average chiropractic office. So we actually have to really work on that. We have 2 meetings a day on our administrative aspect of the clinic to make sure that it runs right, so that not only are we getting people feeling better, but we also want to make it a pleasant experience, and nobody likes waiting at their doctor's office.
No, and that seems to be typically what does happen is everywhere you go is lines, and I don't think it's going to get any better.
No, I agree with you on that. I think we're going to see it get worse.
Yeah, way worse.
Quick.
Okay, so typical patient demographics. Can you tell us who is a typical patient?
Most of the patients, there's 2 types of patients. Most of them are women. Let's start with that. And one of the main reasons why is because women listen to their doctors better than males do. It's just a known fact. If a female is given a prescription for an antibiotic for 14 days, they have like a 95% chance of finishing it, whereas a male only has like a 12% chance. It's just, that's how the mindset is. Women listen better, and they actually do what they're supposed to do.
No, we have some positive aspects to
Yeah, well, that is true. We have to. But that's pretty much how that works out. Yeah. So what happens with women is generally once something starts not feeling right on them, they say, you know, I need to act on this because I don't have time to take out of my day to deal with this later on if it gets worse. For some reason, you know, I guess maybe it's the macho thing. A lot of times men, well, you know, it's hurting me, but I could still get up. I'll wait until I can't get out of bed before I do something about it. So the majority of our patients
You're absolutely right.
Yeah, it's true. You know, I've been playing this game for a long time. Yeah. I see it. Yeah. And so that's one of the big things. And as far as the age groups are concerned, it's really interesting. There's 2 categories. One are I would say about 27 to 33 categories, about half of our patient base, maybe about 40% of our patient base. And that's when people generally start feeling something going wrong from an earlier part in their life, whether they played football or gymnastics or they had an old car accident. So that's when things start, I'm not feeling as good as I used to, I better do something about it now. Then the other category are the people who are about 55 to 70 who said, I'm going to deal with it. Well, now I'm getting older, so I'm supposed to feel miserable. But one day they wake up and either their neck is glued to their shoulder because they can't move it, or you know, they can't get out of bed.
That's the guys who come in.
Yeah.
They got to do something. They can't drive like that.
It's one or the other, but it's usually those 2 type of carries. People who are already starting to feel a little bit, or the ones who waited really, really long down the line.
Okay, so my next question has to do with insurance or or non-insurance patients, and I know we're in a big insurance upheaval right now. Who knows what's going to happen with this? But at any rate, can you address that? What do you take both, or?
Yeah, we actually do. And to tell you the truth, the federal government finally made it easier for us in, I believe it was April of 2013. So we are providers for almost all the insurances in this area. Most insurances like Blue Cross and Aetna and those kind of ones, they just have a straight co-payment. Some of the plans we're considered a specialist and some we're not. The ones where we're considered specialists, the co-payment's a little bit higher. That's basically how it is if you go to a podiatrist or a dentist, the same thing. Medicare has a fantastic program, believe it or not, for chiropractic. Their co-payments are normally around like $7 a visit, which isn't so bad. And for people who don't have health insurance, or if we're not a provider for their health insurance, the government has loosened up their restrictions on us, and we're actually allowed to give them up to a 25% discount. So that's what we do. If someone has no insurance, or if they have a really, really high deductible, because a lot of people have those plans, we're allowed to give them a discount so that it's not as much out of pocket on their behalf.
Okay. All right, well, that's good to know. And how about physical therapy? Are you a provider of physical therapy? Do you do that?
We do also do physical therapy in the office. It's like what you were talking about earlier, where if someone has, they have a problem because of the way they sit at their computer desk and things like that, if we don't address it, what's the sense of doing treatment? Well, the same thing happens if they have a muscle component to their joint problem. If they have a muscle component where they have maybe muscle spasms where they're really, really tight, then we do traditional physical therapy like electric muscle stim, traction. We also have a device called cold laser, which works really good to break up muscle spasms. And if they have weakness in their muscles, then we strengthen those areas so that they don't have this problem reoccurring as they go down in line. So a lot of those, a lot of the general physical therapy we can do in our office as well.
Okay. Do you have the problem when you go to a party or whatever where everybody goes, hey, let me ask you something. I got this, I got this problem with my back. I got this stiff neck. Or what, I mean, do you get that all the time?
I usually do.
I used to have the problem. People always wanted me to bring my camera with me.
Yeah, I can imagine.
So
I can
I had
imagine.
to stop that stuff. But anyway.
Yeah, that happens quite a bit.
Yeah, it does. I would imagine it does.
But it's fun. It brings up a conversation, and I like do what I'm doing. So it's a lot of fun.
So what's your favorite part about being a chiropractor?
To tell you the truth, it's building a relationship with the patients. If someone has a really chronic problem, I'm going to be working with them for a little while, maybe 2 to 4 weeks, sometimes 2 months. If, it's a new problem, they just fell down a flight of stairs and jammed their back a little bit, it may be 1 or 2 visits. But for some reason, most of the patients I see are these chronic cases where I'll see them over a period of time, and it's really nice, actually. My favorite part is seeing their personality change as they feel better. Because when people feel bad, they're not as nice as they normally are. Not that they're mean, but they're not themselves. And as we get that physical stress off their body, you can see mentally they start feeling better. And just seeing that and hearing their stories of what they can do now that they weren't able to do a month ago or 2 weeks ago is really impressive. So I like hearing that positive feedback from the patients.
Okay, and now patients can find you on the web, and they can just call your office and get an appointment.
Yes.
Are you? How long does it take to get in to see you? Are you really backed up, or?
Well, what we have is we have 2 types of new patient visits. One is if someone has a chronic condition, they usually go on a 2-week wait. So it's not like, like some specialists like a neurologist or even a dermatologist. Sometimes you're on a list for 6 months to get in there.
That's why I was asking.
Yeah. Usually it's a couple weeks for that. If it's someone who has a bona fide emergency, we keep 1 time slot open a day for those emergencies, and we usually get 1 of those calls a day. So as long as we're not seeing too many emergencies, we're usually able to get that type of case. We call it our triage visit, where we just go through the basics with them, get them a little care, and then we'll bring them back another day to expand upon what's really wrong with them, just so they can get through the night as opposed to going to the ER or something like that. So usually the most they have to wait is about 2 weeks.
All right. Well, is there anything that I haven't touched on? We covered the whole body, I think.
No, I know you. Everything I think was pretty much covered.
Okay.
The main, like you said, the main difference, what we do is that computerized Pro Adjuster system, and that's really what sets us apart.
Yeah, well, certainly interesting when I talked to you on the phone. I had never even heard of that. So,
Most people haven't, yeah.
That's a good thing to know about. Okay, so if you are in pain or you know someone who could benefit from finding out if chiropractic is a good choice for you, you may consider going to the Pro Adjuster Chiropractic Clinic and try this Pro Adjuster and see what it tells you about your problem. I'm sure Dr. Maggio can tell you whether he can help you or not. And they're in Virginia Beach, and they service people from Eastern Shore. You've mentioned Eastern Shore and of course Virginia Beach, but all over Hampton Roads, including the Peninsula, come to see you.
That's
right?
correct.
Okay, so if you can get to him, he'll see you. So check out his contact information at the end of this video, and it's on this page. And I wish you a lot of success. Sounds like
Thank
you're
you.
doing really good.
Thank you. I appreciate it.
Well, thank you very much. All right.